Hi and welcome. I'm Steve Martirano, and this is the Behavioral Corner. You're invited to hang with us as we discuss the ways we live today, the choices we make, the things we do, and how they affect our health and well-being. So you're on the corner, the Behavioral Corner. Please hang around a while. Hi, everybody. Welcome to the Behavioral Corner. Again, it's me, Steve Martirano. I'm kind of the mayor of the corner. Why not? I just made that up. What do we do on the Behavioral Corner? We talk about everything. It's a podcast about everything because everything affects our behavioral health in one way or another. So, if you're working out, if you're walking, if you're at the gym or whatever you're doing and you're listening, stick around. We got a good one for you. September, which we are into even as I speak, is a National Recovery Month. So what does that mean? Well, listen, in the simplest terms, we all recover from stuff, correct? We routinely recover from everything from colds to hopefully COVID. Folks who also recover from very serious substance abuse issues. In fact, millions do. Okay? So we understand the term recovery in those broad contexts. But we're going to talk about mental health disorders on the program today, because I think we got a different kettle of fish now when we talk about recovering from mental health disorders, whether they're serious or not so serious. To that end, we welcome to the program Kris Kurlancheek. Kris is a first-timer out. This is his rookie at-bat on the Behavioral Corner. He is a clinical supervisor with our underwriting partners, Retreat Behavioral Health. Kris, welcome to the corner.
Thank you, Steve, and congratulations on pronouncing my name correctly.
Well, I had some practice. First of all, it's phonetically, even an idiot like me. But I promise that at some point before we're out of here, I'll screw it up. Anyway, okay. Kris is a second generation Retreat veteran. His dad, who's I guess retired now, was also at Retreat for many years. So I guess that sort of explains how you got there, following your dad's footsteps, so to speak. So how long, Kris, have you been in this field?
In the field since 2004. I started just out of college, so I guess that dates myself. I started working with children and adolescents in a residential facility where they had delinquency, behavioral problems. I did that for several years, did a brief period of time working as a TSS worker, which a lot of young people going through graduate school will do, working with children with autism and their families. I did family-based therapy for a period of time. And then I came into Retreat in 2011, about 4 months after it opened. I started out as a clinical specialist, and that's what I did for the majority of my time at Retreat. I worked with our patients here in the inpatient setting, individually and in group settings. When Retreat was primarily a substance use facility, our department focused on kind of everything else: mental health issues, relationships, family, traumas. Now that Retreat has evolved into a total holistic behavioral health facility that also treats exclusively mental health as well as substance use, I've taken on different roles as Retreat has evolved.
Yeah, their mental health facility or wing is now referred to as Synergy.
Correct.
And for people who might not understand, I want to make the distinction. We don't do this often enough. Kris is obviously correct in that if you come to any competent facility to be treated for substance abuse, there are going to be what are referred to as co-occurring disorders, and they are often of the mental health variety, and they have to be dealt with at some point as well. That's routine, and as I say, better facilities. So what's different now about Retreat is that while they still do that on the substance abuse side, you no longer need to avail yourself of their services. You no longer need to be actively using drugs or alcohol to avail yourself of their services if you're having mental health issues. You can show up there just for your mental health disorders.
Correct.
Got that right. Okay. All right. So, Kris, you heard me do my little intro here. Recovery is pretty easy to see and get your head around in the broadest context. But what exactly does it mean? I'll begin with this question. In terms of mental health disorders, whatever they may be, is recovery even possible?
Absolutely. And I think it's important for people to be mindful and aware of the expectations and kind of what that means for the individual. One of the areas I think that people really struggle is where they or their families, or loved ones, place very high expectations on what that means and what that looks like, where they will try to make attempts to with regards to their mental health issues, get rid of them, avoid them, control them. And that oftentimes makes them worse. Whereas recovery and mental health, for people that would say they're successful with it, often describe it as they're reducing their issues, or like the things that affect them and impact their lives. They manage them, and they learn to live with them, and live with them in healthy ways. They don't become as dominant in their life when they are struggling.
Is it accurate to say that and I've read this somewhere that there's a distinction to be drawn between clinically recovering from a mental health disorder and personal recovery, um, and that they, I guess, come together on the issue you just mentioned. This is about behaviors, mood behaviors that are now out of whack, whatever they may be, and that the idea is to get your expectations lined up with the outcome. In other words,
Sure.
as you said, manage it rather than cure it.
Sure. And behaviors are an important aspect of it, because those are the things that we see. Those are the things that the world sees. But with mental health recovery and mental health issues in general, people will tell you too is that there's the behaviors, but there's also the internal experience that they go through, where the person that you work with might seem fully functional and capable and competent and even happy, but inside they might have a lot of pain that we don't see. So
Yeah.
behaviors are one of the things that we'll see, and one of the ways that we look at symptoms and diagnose. But we also really need to be aware of a person's internal experiences, and that how that affects their daily life.
Yeah, that's a great story. I mean, that's a great take on it. The internal turmoil
Correct.
is often, it manifests itself in sometimes behavior, but sometimes
Correct.
not. Sometimes not.
Correct.
Let's take a moment before we get into the weeds on how these things are treated, and discuss for a moment the types of mental disorders that people are experiencing, and that you've had some experience treating.
Sure. So the most common ones that we see, and the ones that you hear about just kind of day in, day out, that affect most people, are your mood disorders. So that's your depressive disorders, your anxiety disorders, sometimes your bipolar disorders. Uh, those are the ones that you see the most of and hear the most about. Those are the ones that are most prevalent.
Um, and you mentioned bipolar, yeah, and depression and anxiety. When do most people begin to recognize that any of those situations require help? I mean, at what? Because everybody gets depressed, everybody gets anxious. Well, when do people go, wait a minute, something's going on here?
Sure. So there's a couple things with that. That's a good question. So one is to recognize that any issue regarding mental health, not mental, but we're focusing on mental health. Any issue presents very differently across the spectrum with every individual. This is also true when you compare things like adults and children. Children will present anxiety very differently than an adult may. And so the way I've always worked with people and looking at when their mental health impacts them is, how is it affecting your daily life? Because if we look at mental health symptomology on a spectrum, meaning that I can have more of it, I can have less of it, that if I have it, quote unquote, have it, am I still able to function? Am I still able to engage with my family? Am I still able to take care of myself? Am I still able to do the things that bring me joy and peace and contentment? When those things start to become jeopardized or start to become impacted, that's when I think most people will look at, I'm not living the life that I feel like I could be. I feel like these symptoms and these issues are getting in the way of my life more than they're not.
Is it possible in that context to be let's say, depressed for a prolonged period of time, but functioning well enough so that you, in fact, don't have anything that's clinical?
Absolutely. Sometimes I've worked with people and they present with depression, they present with the symptoms, they report the symptoms, and a question that any professional will ask you is, how long have you been experiencing these? And some people say, I can't remember a time I haven't experienced them. Since a child, since adolescence. It's kind of how I've always been. And they, for lack of a better word, they feel comfortable with it. And that's where the kind of discussion, I think, really gets interesting, is because, well, then here's a person that I've known for a brief period of time, and I'm telling them that what they feel comfortable with is not right, is not correct. But it's up to the person. It's up to that individual to make that choice for themselves. Is, do they want something different in their life? And sometimes they do, sometimes they don't.
Yeah, I want to get to that in a bit, because that's a key point about mental disorders. When the person who presents with the symptoms is being defined by other people rather than yourself. Because I guess there's such a thing. You tell me. You're the pro here. Is there? It seems to me likely that there are people who are sort of depressive personalities. I mean, they're gloomy and they don't. They're always seeing the glass half empty, but they're okay. I mean, that's who they are. Is that true?
Sure. Yeah. I mean, I think, again, across the spectrum, there are some people that seem to be like the glass half empty kind of people, which might be, this is where the discussion of personality versus mood comes in. Personality, something that is pretty, crystallized. It might change over time slightly, but moods change a lot more. They're like the weather, some days are hot, some days are cold, and you have seasons with them. I think what is an important distinction to make, though, is that just because someone is comfortable with something doesn't mean that it shouldn't attempt to be treated. So let's talk about physical pain, because sometimes that's a little easier to understand, that if you have a physical pain that could be treated, but you've just learned to live with it, where do we say that that's like, if you fixed your injured shoulder, you might be able to enjoy your life more. You might be able to do things around the house more. And you're like, no, it's okay. I've had it for so long. It doesn't really bother me. It's like, yeah, but if you could live without that pain, would you? Yeah, but that's a lot of work and I'm just gotten used to it. So just because someone's comfortable with it, I don't want to tell somebody how to live their life, but I also want to at least give them the opportunity and the choice to be made that they can change it if they would like to.
Sure. You also run the risk, I would guess, of avoiding something hidden. Why wouldn't you like to be a little cheerier? I mean, you got a great family, you got a good job, people sort of like you, but you're not a lot of fun to be around. That's a great way of looking at this, because I know I've had conversations with people who go, get somebody on to talk about depression, because I don't know whether I'm depressed or not. I mean, some days it's worse than others. So again, the key item, and this occurs, and this would apply also to people who suffer from anxiety disorders. Everybody's anxious from time to time. Everybody's depressed from time to time. What you're looking at is how it affects your life.
Sure. And what I'll say too with that is, like, so where's the difference between talking about emotions and then mood disorders? So anxiety is a normal, natural, healthy emotion to have. We need to have anxiety. Anxiety is what gets us to work on time. Anxiety is what prepares us for important events. But when it becomes too intense or inappropriate at times, it becomes a problem. Just like depression, feeling depressed is a normal, natural, healthy emotion. If you go through a loss or you experience grief, depression, it should happen. You should experience a depressed mood. It would be very odd and unhealthy if you didn't. But if we have them for prolonged periods of time, and they happen at inappropriate times, that's when they can become very impactful in unhealthy ways. And so I think it's important to have that language to say, like, these are not bad words. These are not dirty words. Having anxiety, having depression, like, those are normal, natural emotions.
There's still a big stigma. We talk about stigma a lot, and have over the years working with Retreat here on the Behavioral Corner to a great extent in terms of substance abuse disorder, the public seems to be getting it begrudgingly, and this is not a character flaw, but a disease. But there's still a huge stigma attached to mental health, isn't there?
Absolutely. I agree with you. I think it's slowly turning in the right direction. Um, it's often seen as a weakness. People who struggle with mental health issues will say, I feel weak, or I'm worried that people are going to look at me as weak or inept, or just not able to be a person and be
or crazy. I mean,
right? Yeah.
The old model was, well, they're crazy.
And I think, often a question I get often is about trends that we see. So do we think there is more mental health, incidents currently than there was, say, 40, 50, 60 years ago? I mean, I wasn't around back then, but I can say just that the research that we just didn't ask those questions. So there's a good chance that a lot of those things were there. We just didn't talk about them. We didn't have discussions about them. They weren't in the news. We didn't have professional athletes talking about their mental health struggles. Again, for that stigma. So again, we don't know, but chances are these things have been around a long time. We're just now turning into a more nuanced discussion about them.
Our guest from Retreat Behavioral Health is clinical supervisor Kris Kurlancheek, and we're talking about recovery in the context of mental health issues and mental health disorders. So to go through just one other item on the checklist of types of disorders, some are more serious than others. I would suspect that on a spectrum of disorders, schizophrenia is probably the scariest and most severe form, I guess. But there are gradations of that as well. The thing that's more and more in the news and in history, when you think about it, is something called bipolar disorder. Mm-hmm. And tell us about that. I mean, that's a disorder that really does manifest itself in behaviors, doesn't it?
Yes. I mean, same, statement still applies as before about internal experiences being relevant as well. First, I would like to clear up some misconceptions about bipolar disorder. So sometimes people will say, well, at 9 a.m. I'm happy, and at 10 a.m. I'm sad, and 11 a.m. I'm angry, and then 12 p.m. I'm sad again. I'm so bipolar. That's just being a human being, having mood swings that way. Bipolar, which used to be called manic depressive disorder, which I personally think is a better name, but no one asked me. If you think about bi meaning two and think poles meaning North Pole and South Pole, the South Pole is the depressive episodes. And so thinking about emotions and moods in terms of periods of time. So you can have a depressive episode that'll last days, weeks, and sometimes months. Then what gets a lot of attention is what we call the manic episode. That's the North Pole. And then the manic episode is like the high. That's where a person will have increased goal-directed behavior. Their mood is elevated. They don't need as much sleep. They'll talk really fast, change from subject to subject. They'll be often very impulsive, a lot of thrill-seeking behaviors. A lot of grandiosity will come with bipolar disorder as well. So a person will, they'll think they can drive 130 miles down the highway because they think they can, because they think they're the best driver. There's also another presentation of mania that's the more irritable and angry side of mania that can come out as well.
So what does recovery in the context of bipolar disorder look like? Is it even a real thing?
Oh, absolutely. So I know we might talk about this in a little bit, but with regards to medications, one of the most effective ways to treat bipolar disorder is through medication management. I've had patients say when they are taking their medications and they're working, that it feels like they have a floor and a ceiling. So they still have the ups and downs, but they're not as extreme as they are when they are unmedicated. Research shows that with any kind of mood disorder and most mental health disorders, I would imagine as well, that when you combine medication management and therapy, and counseling. Those are the two components that create successful treatment and successful recovery.
This notion of medicine assisting someone, and by the way, a lot of mood disorders are treated with medicine. Bipolar is not unique in that regard. As I understand it, the prescription or what is prescribed, even obviously by professionals, is more art than science. I mean, they know where to start on a scientific level. This has been successful. Mm-hmm. But people who suffer from bipolar have to really try and test medications, don't they?
Oh, absolutely. I do not envy medical professionals or their patients what they on the work and the patients that they have to go through sometime, patients with a C, that they, if you get a medication that is effective right off the bat, you've kind of hit the lottery. It can take time for the medication to take effect. Now, depends on what we're treating here. For bipolar disorder and the class of medications they might use for bipolar disorder, effects can be pretty quickly, matter of days. But if you're talking about like antidepressants, SSRIs, things like that, they can take weeks to take effectiveness. And then you want to build it up to a therapeutic level. Then if you find that the therapeutic level is not what a patient needs and not what a person needs, and the doctor agrees, then they will have to titrate them off, wean them off of it, and then start a new one, which can take a matter of weeks on both ends. So it can take a long time to find something that works effectively.
Yeah, it takes an enormous amount of concentration and commitment on the part of the person suffering from bipolar disorder to hang in there, because it can be very very frustrating. So before we move to another topic, the final topic in terms of disorders or what might cause them, just this one last point about bipolar. How or any of these other melees, how should the people, the support group, the family, the friends, the coworkers surrounding somebody in these conditions, how should they behave? Should they ignore it? Should they, or should they accept it and talk about it? What's the role of family and friends here?
Sure, that's a great question. So first off, specifically with bipolar, one of the larger challenges with treating bipolar disorder is that for the individual, often they will like their mania. Their mania can feel very powerful. They feel, for lack of a better word, they feel good, especially contrasted with the depressive episodes. When people are in their manias, they can feel productive, they feel happy, they feel connected. Why do I need to treat this? I feel great. The first question that I will often ask somebody that will have that type of narrative, I'll ask them, well, how does it affect your relationships? When you're in a manic state, what does your family say about being with you? What do your friends say about being with you? And if they're honest, often people say, it's really hard to be around me. I bring a lot of energy into the room. And so that will be one of the good external motivators for somebody to try to get help for something that they feel that's good for them.
When they're out of the manic stage, are they aware of their behavior while they were in the manic stage?
Hopefully, that is one of the things that we would try to do in counseling, is work on a lot of mindfulness and mindful awareness, which is a good foundation for any therapy, to know where you are at with your moods. To know it, because people who lived with bipolar disorder or any mood disorder can tell you, when it's about to come, what it looks like. And sometimes it'll kind of sweep them away and before they realize it. But if they're practicing those mindfulness skills, they can kind of take some steps to manage it a little bit better.
2 points. So there are triggers, and there are triggers that can trigger a manic episode, and people should be attuned to what they are, maybe avoid them. But the second one, I want to be clear on this. And I know it's not a universal rule, but generally speaking, during a manic episode, is the person experiencing, and I understand what you're saying, don't harsh my mellow. This is what are you crazy? Take the drugs. I'm having a great time. But are they aware that that is irrational? That's the wrong attitude to be having, and are powerless to stop it, or does that have to come after the episode goes away?
If a person's into it, like just like anything, there's mild, moderate, severe manic cases. When they're in the moderate to severe, that awareness goes down. It's especially when you with something that's specific with mania, that when you have this grandiosity component to it, it's hard for a person to have an awareness that they're in this state until they can kind of come down to that mild state, and they can kind of bring some awareness to kind of what's going on around them. I would like to answer your family question too, if that's okay, Steve.
Yeah, go ahead. Sure, go ahead.
I kind of skirted around it. So with family, coworkers, and friends, it's really it's a balance. And one thing I always encourage when I work with families is to, really have an expectation of what your role is in your family with your friends, because when we have people in our lives that are suffering, that are struggling, we want to help them. And so people often try to turn into their therapists, will try to turn into their doctors. And the intent is noble. The intent is they're really trying to help. And I don't fault people for trying to help. But then the problem is that it kind of, you get these dual roles that can create problems. I mean, look, I'm a trained clinician and therapist. I'm not a trained clinician and therapist for my family. People ask my opinion on things, and will always say, well, you should go see a therapist. Well, you're a therapist. Yeah, but you should go see one on your own, because I want to be your family member. I don't want to be your therapist. And so understanding those roles, and then asking the individual what you need from us. What can we do to support you? What can we do to help you? And even if they push away, we give them that distance, and we can love from a distance. If you ever have concerns, this is important to say, if you ever have concerns about a person's well-being, their safety, it's not a wrong thing to err on the side of caution, to call professionals, to call crisis, to call them, to help them get into the hospital if you're afraid that they're going to hurt themselves or somebody else.
Yeah.
Never second guess those things.
That's a great point, Kris. Thanks for making it. I want to move into this area of trauma.
Sure.
Trauma is not one thing. It can be many things. It can be physical. It can be psychological. It can be events that you witness. It can be a number of things. Speak a little bit about the mental health consequences of having suffered a trauma.
Sure. So often people will have this question of why. And so I have these issues, I have these symptoms. Why do I have them? No one else seems to have them. What happened to me, or what's wrong with me? And a lot of energy will be put into kind of searching for that why question. And some people will find answers, some they won't. We do know that people who experience adverse childhood experiences, or ACEs, they are more likely to develop mental health issues, physical issues even. It's also important to be said that people can develop mental health issues without trauma. Those are present themselves. But then also we get into the present state where someone going through a mental health issue, that is traumatic itself. A person who's going through substance use or addiction, that's traumatic in of itself. But we do know that people who experience any kind of abuse, bullying, neglect, exposure to violence, exposure to life-altering critical events, those can certainly impact a person at that time or later in life, whether they're aware of that or not.
Kris, thanks so much. It's a big topic, and we could talk about it a very long time. We focused, as I said at the beginning, on this issue of recovering from it. And I come away from what you said hopeful for people who have these problems, because again, at the end of the day, if I understand you correctly, recovery, which is possible, looks different in different situations.
Yes.
The bottom line being, whatever's troubling you, recovery means being able to have a full and happy life in spite of it. Yeah.
Correct.
Anyway, great. I appreciate it. I know that you told me when before we did this that you said I've been avoiding having to talk publicly. You should do it more often. Kris Kurlancheek of Retreat Behavioral Health, terrific kind of introductory speech, as it were, on recovering from mental health disorders. Appreciate it, Kris.
Thanks, Steve. Thanks for having me.
And thank you guys for your time and attention. Don't forget to push the button that says subscribe. We appreciate that. Push that. Follow us on Facebook and wherever else you follow us. Follow us in your car if that's possible. It's the Behavioral Corner, and we'll see you next time. Take care. Bye-bye.
Retreat Behavioral Health has proudly been serving the community for over 10 years. Here at Retreat, we believe in the power of connection and quality care. We offer comprehensive, holistic, and compassionate treatment from industry-leading experts. Call 855-802-6600 or visit us at www.retreatbehavioralhealth.com to begin your journey today.
That's it for now. And make us a habit, hanging out at the Behavioral Corner. And when we're not hanging, follow us on Facebook, Instagram, and Twitter on the Behavioral Corner.